I just,
Yeah, you can,
Okay, love that. All right. Hey, my name's Allie. I'm going to be your nurse today. Can you tell me your name and date of birth?
Yes. It is, I just make up my name and date of birth.
Tell who you are.
Oh.
Jenny.
Oh, okay. I'm Jenny St. Jacques,
Okay, date of birth?
April 14th.
Okay, perfect. Do you know why you're here today?
Yes. I am not feeling good. I have, wait, is this what I said I have? I'm sorry. Patient reported. I feel like I'm short of breath today.
Okay.
And I haven't felt like eating much lately, and I've been kind of tired.
Okay. Do you know where you're at?
I'm in the hospital.
Okay, perfect. And do you know what month it is?
It's March.
Okay, awesome. Patient's alert and oriented ×4. As I'm talking to her, speech is clear. She's cooperative, reacting appropriately. Lying in the bed, behavior's calm. Okay, do you have any pain today?
A little bit, yeah.
Okay, where's your pain at?
It's in my leg.
Okay, when did that start? Here, where this?
Yes.
Okay.
It started last night when I bumped my leg.
Okay, and then you've gotten some acetaminophen to treat that. Has that helped your pain at all since the
Yes.
previous? Okay,
A little
perfect. What would you rate it right now from
It's-
1 to 10? 10 being the worst.
I'd say it's a 5.
Okay, sounds good. Okay, perfect. And then I'm gonna do your vital signs real quick. Okay, before we move on with our assessment. Oh, right. I'm so sorry. This side. So temperature.
101.4.
Okay. And then I'm gonna take her blood pressure. While I'm taking her blood pressure, I'm also counting her respirations. What are her respirations?
24.
Okay. And then blood pressure.
104/58.
Okay. Taking her pulse. What's her pulse?
116.
16. Okay. And then her O2 sat.
91%.
91%. Okay. Is she currently on oxygen?
No.
Okay. So I know we're not really doing implementation, but I'm probably gonna put some oxygen on you while we're doing the rest of our assessment. Or check the orders to see if there's an order in there for oxygen if it gets below a certain point. Okay. So did vital signs. I'm gonna look in. The light's not going. Looking in your ears. Can you look up for me? Nose, mouth open wide. So all mucosa is pink and moist. Don't see any drainage or anything. I'm gonna check your eyes. So go ahead and just look forward at me. Okay. And then just follow this pen light. So perilla is intact. Pupils are about 3 millimeters. And then I'm gonna move to skin. So skin is warm, dry. I'm looking for any wounds, incisions. So I'd look at her leg and it looks like there is some bleeding. So I would need to probably redress that bandage. No tenting. Look at your cap refill. Less than 3 seconds, unless you tell me otherwise. And then I'm not seeing any pallor. The color looks normal. And then go ahead and listen to your, let me just put this right here. So go ahead and listen to her heart. So I'm starting over here at the aortic spot. Move over to the pulmonic, down to Erb's point, down to tricuspid, and then mitral. S1 and S2 are present and rate and rhythm is regular, unless you tell me otherwise. And then do you have any numbness or tingling?
No.
Okay. Rate and rhythm is regular. S1 and S2. Okay, sounds good. And then I'm gonna listen to your lungs. So I'm gonna start, oh, you're good. Start over here, come across, and do 8 spots on her chest. I'd be having you take a deep breath in and out for every one of these. Okay. And then go ahead and lean forward. 10 spots on the back. Deep breath in and out. So as I'm doing this, I'm not seeing any retractions. Breath sounds are clear and equal bilaterally unless they aren't. They are, okay. And work of breathing seems unlabored. Do you feel like you're having a hard time breathing at all? Because you said shortness of breath when I first came in. Okay. Has it helped at all since we threw that oxygen on?
Yes.
Okay, great. And then after that, so I checked the oxygen, got her on some now to check the orders, and O2. Okay. And you had a cough. So have you had any sputum as you've been coughing? Have you been able to get anything up?
No sputum.
Okay. Had you feel like you're trying to get something up and just can't?
A little bit.
Okay, gotcha. And then I'm gonna move to musculoskeletal, so push away. Okay, pull me towards you. Okay, can you squeeze my fingers? I'm sorry. Yes. And then I'm kind of just looking at your hands, so I don't see any edema. I already felt her radial pulses and did your cup refill. And then go ahead and just like flex your arms for me, okay? And then feeling your pedal pulses. All these pulses are equal and strong bilaterally. Looking for edema, cap refill. So pull me towards you, great, and then push away like a brake. Okay. So strength's intact. Wiggle your toes. Range of motion seems equal and intact. To assess gait, when I'm done, I take her to the bathroom. She has to go and assess the gait then. I don't see any like swelling or abnormalities of the joints other than what we already talked about there. Haven't assessed your IV yet, so I'd look at her IV and make sure there's no like redness or swelling. Do you have any pain or burning right now with the IV? Okay. There's nothing leaking. I check to make sure it's patent and flush. Listen to your bowel sounds real quick. Okay, so I'm going to all 4 of the quadrants. Bowel sounds are normoactive. I'm going to palpate. Do you have any tenderness?
No.
No? Okay. When was your last bowel movement?
This morning.
Okay. Was it solid? Not solid?
It was normal.
Okay, felt normal. And then have you had an appetite lately?
Yeah, it's been fine.
Okay, how much of your breakfast did you eat this morning?
All of it.
Very good. And then have you had any issues urinating?
No.
Okay. Is she on a Foley or anything? If she's on a Foley, I would check about the amount, color, quality, same as she was on a PureWick, of the urine. And then you didn't have any paralysis. I already did all your range of motion, pulses, pain. You didn't have any numbness or tingling. Assessing all the lines. I did the IV. No drains or anything. I'm trying to think if there's anything else. Temperature. And I can't think of anything. But I'll make sure that the bed is low and side rails are up and call light is within reach.